have been passed that criminalize healthcare providers. In a couple of states, prison for life, Oprah. Prison for life in a couple of states for a doctor or a nurse who provides health care.
You are exactly right, Madam Vice President. And the question is, what are you going to do about it? Thousands of innocent doctors are in prison right now for trying to help patients suffering from chronic pain and addiction, as well as other psychiatric issues like ADD and anxiety. This may have started under the Trump administration, but it accelerated dramatically under the Biden-Harris one. And what are you going to do to fix it? Hello and welcome to the Center for Medical Justice. I'm Dr. Joseph Parker. Today we're going to be discussing a few issues. As you know, I review physician prosecutions looking for signs of true intentional criminal conduct. And in about maybe 20% of the cases, I actually find it. Let's review one PCP and two psychiatrists that have been targeted in the recent past. The first is Dr. Donald Siao of California, then Dr. Mohammed Osh of Massachusetts, and Dr. David Brody from California. Now, you may notice that the first two have names that are indicative of minority ethnic origins. Dr. Siao is Asian. Dr. Osh is from what we'd call the Middle East, but more specifically Syria. You will remember Dr. Rafai was from Syria also. Why is it that over 50% of these prosecutions are ethnic or religious minorities? And while Dr. David Brody might not sound like it has an ethnic origin, he is indeed Jewish. It's interesting. For Dr. Siao, this is from the Justice Department's own press release. Now, they don't show the courtesy of saying doctor, so I will read it the way they wrote it. The undercover agents received prescriptions from Siao, despite complaining of only vague pain or discomfort, requesting specific opioids by name, and admitting to sharing the pills with friends and coworkers. So what exactly does this mean? This means that after probably several years of investigation, they could find no reason to prosecute the doctor. So they either sent in a compromised patient who had been pressured or coerced to say certain things, or an undercover agent. And we can see this best with an examination of the next doctor's prosecution. This is Dr. Osh. They say Dr. Osh deliberately and recklessly jeopardized patient safety by repeatedly prescribing dangerous combinations of benzodiazepines and stimulants. This case underscores our office's unswerving commitment to justice, patient safety, and the responsible management of healthcare resources. Ensuring the well-being of patients is paramount. Well, if ensuring the well-being of patients is paramount, why have 1 million of them died in the decades since you started targeting physicians? 80% of primary care physicians, like Dr. Siao, are now too terrified to treat pain. And if you have chronic pain, they're saying, I will prescribe you nothing effective for it. And when I say effective, I mean something that actually works. When you tell someone to do yoga or acupuncture for pain, that should be in addition to a more effective treatment, right? Because while those things can help temporarily, when you're trying to sleep, you can't do yoga in your sleep. You can't meditate in your sleep. Those interventions are brief. I could give you a $100 bill and it would ease your pain better than almost any other non-pharmaceutical intervention, except maybe for transcranial magnetic stimulation and things like that. Something for which actually Dr. Osh actually had. He offered alternative treatments. These are doctors who are trying to ease the suffering of their patients, and when the DEA has invested a certain amount of money in them, it will not let it go. So they started investigating Dr. Osh in about 2014. By 2016, they could find nothing. So they found a disgruntled employee who would recommend a patient from another practice and verify for that and kind of validate that patient, to vouch for that patient and say, can you bring him in, please? He needs help. Okay. He's supposed to be treated for these problems before by other doctors. This before the PMP was everywhere and you couldn't check in every state or most states. This is back 2014. 2016. So the patient comes in and they lie to the doctor. They say, I have ADD, I've been under treatment with these medications and they worked well. Can you please continue my therapy? That's what the government means when they say the patient asked for specific medications and gave vague complaints. First off, they have no right to determine what is a vague complaint. They are not doctors. Okay? So these are differences of medical opinion that are being enforced with the barrel of a gun. And let's look at David Brody, Dr. David Brody. So Dr. David Brody worked for Dunn Health. They treated ADD and they expanded into telemedicine during the pandemic. So everyone was afraid to go to the doctor's office. They reached out for patients to make sure you could get your ADD medications. They had the testing was required. There was a screening process. You would see a psychiatrically certified healthcare provider, and they would provide your medications for you. This was all allowed. This was all allowed during the pandemic. So now the DEA comes back and says, you didn't do a physical exam. Well, you can't do a physical exam over telemedicine. These people aren't that stupid. They're this corrupt. They are lying to the public purposefully to malign these doctors. And they says, oh, but some of the patients didn't need it. They scanned through 10,000 patient interactions to find one that lied convincingly. And let me tell you something. No one can lie more convincingly than an undercover agent, because that undercover agent has been trained to lie. While it is a crime for a citizen to lie to a federal agent, it's not a crime for a federal agent to lie to a citizen. It's standard operating procedure. So these people come in, these undercover agents or compromised patients, and they lie to the doctor and they get a prescription, and then they pop up in court and say, I didn't really need it. I gave clear signs of red flags. First off, red flags are not a crime. There's something for the doctor to consider. Secondly, when a patient comes in and says, I borrowed some medicine from a friend and it worked for me, and you tell the patient, don't ever do that again, you have fulfilled your responsibility as a doctor if you believe them when they say that they won't. Just like a psychologist cannot turn you in. You can go to a psychologist and say, I murdered 2 people. And he says, well, are you a threat to yourself or others right now? No, I'm not. He doesn't have to turn you in. He doesn't have to call the police and report that you murdered 2 people. Right? Physicians are in the same situation. People will not come to us and tell us the truth. If we are obligated to fire them as patients and say, I can't help you, right? It's not uncommon for people to try to self-medicate. Those with anxiety use alcohol, and if they encounter benzodiazepines, they recognize that those might help them with their panic attacks or with their chronic anxiety. Now, are there other medications to be added, and are benzodiazepines dangerous? Absolutely. You should watch the BIND study that I did a report on. We should use caution before starting someone on medications, but that's not what we're talking about. This is continuing someone on a medication, continuing. And studies after study has shown that stopping someone's medication when they are receiving therapeutic treatment is always detrimental. So someone comes to you on benzodiazepines and opiates, 2 of the things that the DEA just says you should not do. It is not their place to say you should not do it. The FDA has said these medications can be used together. Otherwise, they'll say don't, and there'll be a contraindication, right? Doctors even sometimes override contraindications for good reasons. Like if someone's on Coumadin, back when we only had Coumadin to thin blood and it wasn't working well enough, you might add a little Bactrim to boost the effects of the Coumadin. Even though those are contraindicated, you might use a tiny dose in something called rational polypharmacy. But what we have instead is irrational dictates from the DEA saying, I will decide your medical care. Recent documents I saw said that whether or not to prosecute a doctor is left to the DEA agent who did the investigation. They are not doctors. They don't know if these are valid medical decisions or not. Now, back in the case of Dr. Osh, recklessly prescribed repeatedly a dangerous combination of benzodiazepines and stimulants. Those aren't dangerous together. This shows the absolute stupidity of the DEA when it comes to medical practice. Stimulants and benzodiazepines do opposite things. Okay. Benzodiazepines act through the gamma-aminobutyric acid receptor to slow neuronal activity. Stimulants react differently. They cause the release of norepinephrine and other stimulants to increase neuronal activity. You are less likely to overdose on benzodiazepines if you have a stimulant on board, and you're less likely to overdose on a stimulant if you have benzodiazepines on board. These people have no clue about the practice of medicine. And I don't blame them. I blame the politicians and the courts that are allowing this to happen, because they should not be allowed to make these decisions. It takes 4 years of medical training before you have a valid opinion on the practice of medicine. 4 years. We don't let nurses prescribe medications, even though they are eminently qualified and extremely experienced and knowledgeable, because that's not what they were trained to do, right? We don't allow pharmacists to prescribe medications, despite the fact that they have a doctorate of pharmacy, because they don't have a doctorate of medicine. Now, pharmacists can do extra training and get prescribing privileges, much like a nurse practitioner or a physician's assistant or something like that. There are still things that they might be limited to, but you got a pharmacist that has his prescribing privileges, that's great. But a pharmacist who does not have prescribing privileges is not trained to prescribe, and that's why it requires additional training. Okay, so how do they convict doctors in these cases? They do it by going to trial and parading these compromised patients and lying undercover agents who get up there and actively lie on the stand in many cases. In Dr. Rafai's case, if you listen to my interview with him, you will see where they actually lied on the stand and said, oh, that's not a real chart, but it's got your date of birth. How did they guess that? It was also THC in the police officer's sample. Maybe that's why they wanted the document to be false, because they're breaking the law. Paying people to testify compromises the integrity of our judicial system. And this is something that I have a big problem with. If you read the transcripts of Dr. Rafai's trial when they're available, you will see how they created his prosecution out of whole cloth. And they do the same in other cases when they can't find true evidence of criminal conduct. What's true evidence of criminal conduct? Did the doctor sell a medication by the milligram or by the dose without seeing or evaluating the patient at all, without reviewing medical records? That is criminal conduct, according to the case of Dr. Thomas Moore, first case to go in front of the Supreme Court after the Controlled Substances Act. Controlled Substances Act was passed in 1970. I think Dr. Thomas Moore was 1974. And by 1975, the Supreme Court said, yeah, you can go ahead and prosecute him because he's acting no differently than a drug dealer. So when it comes to every other doctor prosecuted, the question should be, did they sell medications by the milligram or pill count? Did they see the patient at all, evaluate the patient at all, review records at all? If they did any of those things, then the DEA should not be allowed to indict you. Not that you should be able to allow to argue in court, because once you make it to court, you are done. Our conviction system rolls in one direction. It's like a giant machine. When you get acquitted like Dr. Rafai was, that means the machine broke down somewhere, and they will rapidly try to fix that problem. They own the playing field. They control the evidence. They can coerce and pay witnesses. They can do anything they want, and no one can hold them to account. A prosecutor was recently caught prosecuting innocent people, seizing their assets, giving the assets to the whistleblower accomplice, and that accomplice was giving kickbacks back to the prosecutor. How do we know this? Because it was a state prosecutor. If it was federal, we would never hear about it, because there is no one to investigate the federal prosecutors. Now, the Office of the Inspector General is supposed to police federal agencies, make sure they're following the rules. But the Department of Health and Human Services, Office of the Inspector General, is actively taking part in these raids. So you've got internal affairs out on the street, arresting people and throwing them into the van. So what are the odds that the DHHS OIG is going to take a look at themselves and say, oh, we were wrong. We shouldn't have done that. Our metrics are flawed. We have a misunderstanding about the basic process of medicine itself. Zero. You have now corrupted the only internal affairs division that we have in federal agencies. And the Office of Professional Responsibility is what federal attorneys are supposed to be investigated under. They are not prosecuted. Those offices exist, I would argue, to deflect and protect federal prosecutors and agents from criticism. They hide things. They don't go public with it. You will never see a press release, right? You will never see a press release. An assistant United States attorney gets caught practicing law without a license for 12 years. No press release. No, she committed a felony every year that she signed saying she had a valid license. Absolutely true. According to the Arkansas State Supreme Court, that finding is true. It doesn't matter because they will not prosecute themselves and no one can make them. So it's not that we have two systems of justice in this country. We have no justice at all. We have a conviction and incarceration system. And Dr. Rafai is a very, very lucky man. And Dr. Mohammed Ash was not so lucky, and he will be going to prison. Dr. Donald Siao has appealed, and perhaps he has a chance. Dr. Brody has not gone to court yet, and hopefully he will be able to learn from Dr. Rafai's experience. For all of the doctors, patients, and attorneys who are going to be addressing in any way these issues or just want to understand them, my transcripts, trial transcripts, have been published, and I will put a link in the description. You can access them and read them, and nothing will explain to you better how they get their convictions than by reading this. No one said I had criminal intent. No one said I willingly or knowingly broke the law. All they said was he was willfully blind to the opinion of the extremist we dug up in the state of Florida to come in with a medical degree and say, this is outside the usual practice of medicine and not for legitimate medical purpose, which I think violates Diaz because they're answering the ultimate question, but I'll leave that to the attorneys because they know more than I do. And quite frankly, trying to understand the law in the United States of America breaks my brain. I understand quantum mechanics pretty well. I understand rocket science. I can quote you Tsiolkovsky's rocket equation. I can do it by hand. You tell me how much a rocket weighs and what the fuel and oxidizer is, and I can tell you, if I know the specific impulse, how far it'll go, whether you can get to the moon or not. Law doesn't follow any logic or reason in the United States anymore. In fact, the state of Missouri just put to death a man that the prosecutor said should not be killed, that the victim's family said should not be killed. But the court said we no longer have a mechanism to correct our mistakes. So we must kill him to continue this appearance of infallibility. Ladies and gentlemen, this is not the country I wore a uniform to protect. I was proud to serve my country in the 80s as a Marine and in the 90s as a U.S. Air Force officer in command of nuclear weapons because I believed that we had a moral purpose and I believed that we were a just country, or at least we were trying to be. We are no longer trying to be. And the American public is not starting to hate the American media because they sometimes get it wrong. We're starting to hate them because they no longer care about getting it right. And it doesn't seem like the courts do either. This man appealed to the Supreme Court, but the U.S. Supreme Court has said as long as your trial was technically correct, there's no reason to stop your execution, even if you're innocent. The founding fathers would have something different to say about that, especially Benjamin Franklin. Thank you for listening. Stay safe.